Understanding of mechanism of mind and body. Understanding of mechanism of mind. Understanding of the mind. Each person has his or her own feelings and ideas. The feelings, ideas, and methods of expression differ from persons to person. The difference is related to the character of the person, the life she or he has lived, and the education he or she has received. The feelings and ideas change due to aging and are expressed as emotional and will. It is necessary for the care worker to understand the feelings of others. For example, emotion, being happy, being mad, being sorry, or having fun. Changes in the state of mind are visible in facial expression and attitude. Will. Will refers to the state of mind to positively to do something. Care worker support user to live willingly. So that is the will. I want to take a walk outside, says the user. So the care worker will going to give him support because the user has a positive will to go outside. Okay, walk outside. Then we have stress. Stress refers to the state of strain in the mind and body. The causes of stress include noise, temperature, and other physical factors, fatigue, shortage of sleep, hunger, and other bodily factors. We have anxiety, fear, excitement, and human relation, and other psychological and social factors. Cause of stress. Memory. Memory means the ability to remember things without forgetting. So the process of memory. There are processes of memory. So memory means the ability of remembering things without forgetting. That is memory. And there is process of memory. Number 1, memorization. To memorize new things. Then we have retention. To retain the information. And then we have recall. To bring the information back into your mind. Memorization, retention, and recall. We have kinds of memorization or kinds of memory. We have the short-term memory. Short-term memory is temporary memory. And we have long-term memory, which is the memory retained for a long time. For the long-term memory, we have episodic memory, which is memory of experience of a specific event. That is episodic memory. Memory of experience and specific event. So we have semantic memory. This is memory of knowledge. That is priming memory. Memory that is unconsciously remembered. That is priming. And we have procedural memory. Memory that one's body remembers. Procedural memory. So, repeat. Episodic memory is a memory by experience and specific event. Semantic memory, memory of knowledge. Priming memory is memory that is unconsciously remembered. Prime. And procedural memory is memory that's the body, one's body remembers. Memory that one's body remember. And now we have the needs. Needs refer to the state of mind in which the person wants to get something. A.H. Maslow, a psychological advocate, 5-level hierarchy of human needs. Maslow hierarchy of needs. So, we have 5 Maslow hierarchy of needs. We have the social needs and basic need. So, from the basic needs, it's like a triangle. This is the base. Basic need we have, number 1, psychological needs. Needs to sustain life. Okay, we have number 2. We have safety needs. Needs to protect oneself. Safety needs, number 2, needs to protect oneself. So number 1, physiological needs is the basic, and then next is the safety need, needs to protect the self. For the social needs, we have 3. 1 is love belonging needs to be involved with others. Number 4, self-esteem needs to be recognized by others. Number 5, self-actualization needs for maximizing one's potential. Understanding of mechanism of the body. Mechanism of sustaining life, homeostasis, body temperature, breathing pulse, blood pressure, etc. Hemostasis. Homeostasis is a biological system in the body that tries to maintain a constant state even if there is a change in environment. One example is a function that works to bring the body's temperature back to normal by sweating to release body heat when it rises because of the hot air temperature. The function of homeostasis, for example, when it's hot, we sweat when it's hot. We have vital signs. Vital signs refers to the body temperature, breathing pulse, blood pressure, etc. that indicate the symptoms of being alive. There are indices that reflect the status of health and any unusual change. Body temperature. Body temperature has daily rhythm. It's high during the daytime hours and lower during the night when you are asleep. As there's a big difference among individuals, normal temperature differs from person to person. Parts of the body in which measure body temperature and points to remember. Armpit. Place the tip of the thermometer in your armpit. Keep your arm pressed firmly against your body while taking the temperature. If a person suffers from paralysis, take the body temperature of the unparalyzed side. And we have other parts. The thermometer measured by temperature in the forehead or the ear. So we have breathing. Breathing is to take oxygen into the body and get rid of carbon dioxide. Breathing is done regularly and unconsciously. Respiratory rate changes due to various factors such as age, activity status, mental status, physical condition, and whether the person has a disease or not. So the respiratory rate changes due to that factors, such as age, activity status, mental status, physical condition, and whether the person has disease or not. Check whether the person is having difficulty of breathing and having a phlegm, or if she has hearing odd sounds or not. If a person has extreme difficulty of breathing and lips and nails turn into bluish purple, this state is called cyanosis. Respiration rhythm waveform. Normal adult is 12 to 18 times per minute. The person is inhaling and exhaling regularly. We have the pulse. So the pulse is a movement of the blood through arteries caused by heartbeats. Generally, the lower the age is, the higher the pulse rate. Pulse rate goes down when you get older. Pulse rate changes due to various factors such as age, activity status, mental status, physical condition, whether the person has disease or not. Observe the number of rhythm of pulse and whether it is strong or weak. Place to measure the pulse rate. We have the brachial, we have the brachial artery, and temporal artery, carotid artery, brachial artery. Locate the pulse on the wrist. You can locate the pulse not only in the temporal region, neck, elbow, but also on the inside of the wrist, groin area, and instep. Blood pressure. The blood pressure is the force of the blood sent from the heart pushing against the wall of the blood vessels or arteries. Blood pressure changes throughout the day. Blood pressure changes due to various factors such as posture, activity status, mental status, and whether the person has a disease or not. Continuous hypertension increases the possibility of developing into cerebrovascular disease or heart disease. Relationship of the state of the heart and blood pressure. Systole of the heart, diastole of the heart. So systole of the heart, the blood pressure high. Diastole of the heart, the blood pressure low. Systole blood pressure, the highest blood pressure. The blood pressure when the heart is contracting is systole. Systolic blood pressure, the lowest blood pressure. Blood pressure when the heart is relaxing, that is this diastole. The blood pressure goes up when a person gets excited, short sleep, strain in the toilet, gets nervous, experiences suddenly change in temperature, engage in sudden exercise, is suppressing an urge to defecate or urinate. For example, he's driving and you want to go to the toilet but he can't go to the toilet because he's driving. Disease caused by hypertension is cerebral infarction, cerebral hemorrhage, subarachnoid hemorrhage, hypertension, hypertensive retinopathy, angina pectoris, myocardial infarction, and atherosclerosis. The basic structure of human body. A human body can be divided into head, cervix, trunk, upper limb, and lower limb. Basic structure of human body. We have the head, cervical. We have the limb and lower limb. We have the chest, abdomen, or the trunk. We have the palm and the sole of the feet. Nervous system. The nervous system can be largely divided into the central nervous system and peripheral nervous system. The central nervous is the brain and the spinal cord. The brain gathers the information from the rest of the body, analyze and make judgment, and gives order to the rest of the body. That is the central nervous system. And also, the spinal cord is connected to the body, to the brain, makes your own judgment and information, and it gives order to the base on function of relaying information from brain to the rest of the body and vice versa. Peripheral nerves. Cerebral nerves, spinal nerves. Peripheral nerves relay information between the central nervous system and the organs of the body. Peripheral nerves is a central nervous system and the spinal nerves. So we have distribution of nerves. For the central nerves, we have the brain and spinal cord. For the peripheral nerves, we have cerebral nerves, 12 pairs, and 31 spinal nerves. For the central nerve, we have the brain. The brain has cerebrum, diencephalon, mesencephalon, the midbrain. We have the pons, and we have the cerebellum and the medulla oblongata. And then we have the spinal cord, which is connected to the head, chest, and abdomen. While the peripheral nerves, we have cerebral nerves, which has 12 pairs, and spinal nerves, which has 31 pairs. So for the central nerves, we have brain and spinal cord. Peripheral nerves, we have central nerves with 12 pairs and spinal nerves, which has 31 pairs. Regions of the brain and their function. The encephalon or interbrain. Center control of the autonomic nerves, control of body temperature and sleep patterns, etc. Sa parts of the brain, we have cerebrum, thalamus, and then we have the hypothalamus. We have the cerebellum. Cerebellum has coordination of the balance of the body, regulation of motor movements. Cerebellum, balance. We have the brainstem. It controls life-supporting functions such as heart regulation rate, respiration, swallowing, etc. The brainstem controls life-supporting function. Then we have mass under the brainstem. We have mesencephalon, the midbrain, and pons, and medulla oblongata. Autonomic nerves. Autonomic nerves. The autonomic nerves act consciously and regulate the function of internal organ. Autonomic nerves is act consciously and function in internal organs. They consist of sympathetic and parasympathetic nerves. Autonomic nerves consist of sympathetic and parasympathetic nerves. So the sympathetic nerves act when the person is tense, such as when the person is active or feeling anxiety, anger, and stress. The parasympathetic nerves acts when the person is relaxing, such as while sleeping and resting. Activities of autonomic nerves. The sympathetic and parasympathetic nerves. So for the sympathetic nerves acting, we have the pulse rate increase, constrict, goes up, dilate, decrease movement, bronchi dilate, increase. We have the parasympathetic. This is resting. Pulse decrease, dilate, the blood pressures go down, the pupils constrict, the intestinal tract promotes movement, respiratory, bronchi constrict, and the sweating decreases. For the sympathetic nerves, the pulse increase, the heart rate, constrict peripheral blood vessel for the sympathetic. Dilate the pupils. For the parasympathetic, it constrict the pupils. Decrease movement in intestinal tract for the sympathetic, but the parasympathetics promotes movement. Bronchi dilate in sympathetic for the respiratory tract, and bronchi constrict for the parasympathetic. Parasympathetic increase sweating, parasympathetic decrease sweating. The autonomic nerves control the function of the internal organs, etc. The autonomic nerves. When the autonomic nerves are not working properly, your heart and other parts of the body are affected in various ways. So, skeletal system. Skeletal system of the human body consists of combination of big and small bones. The major function of the bones is to support the body, to play the part of the locomotor system, to protect the internal organs, to store calcium, and number 5, hematopoietic function. Physiologically, the human spine is curved in S shape. Skeletal chart of human, we have the skull, we have the sternum, humerus, radius, ulna, we have the ribs, and femur. For the cervical, we have, for the spine, we have the cervical vertebrae, thoracic vertebrae, and the lumbar vertebrae. Muscular system. Okay, the muscular system is related to the maintenance of posture, locomotion, and the formation of internal organs. That is the muscular system. In the back, we have the tricep brachii muscle, we have the gluteus maximus muscle, and we have the bicep femoris muscle. In the front, we have deltoid muscle, pectoralis major muscle, bicep brachii, iliopsoas muscle, and we have the quadricep femoris muscle. Sensory organ system. When we sense vision, hear, sense of hearing, sense of smell, taste, sense of taste, touch, sense of touch, things, and sensory organs receive various stimuli and send the information to the brain through sensory nerves. Mechanism of vision. Retina is a thin layer of tissue that lines the fundus of the eye. Retina is a thin layer of tissue that lines on the fundus of the eye. It protects the image, projects the image, the retina. Crystalline lens. The crystalline lens is transparent and shaped like rugby ball. It adjusts the focus on an object. Optic nerve. The nerve sends the stimulation from retina to the brain. Mechanism of hearing. From tympanic membrane. Tympanic membrane receives the sound wave as vibration. Then goes to the number 2, auditory ossicles. Auditory ossicles amplify the sounds. Number 3, the cochlea changes the vibration into signal. And then number 4, auditory nerves. The auditory nerves carry the signals to the auditory cortex of the cerebrum. Respiratory system. The inhaled air passes through the respiratory tract. The oxygen is received in the lungs and the carbon dioxide is discharged through the tract. The respiratory tract in the path, the air takes from the nose and the lungs. So the respiratory organs, we have nasal cavity, we have the pharynx, larynx, trachea, bronchi, the lungs and bronchi. Cough and phlegm. When bacteria, house dust, and other foreign matters enter the respiratory tract, the human body tries to get rid of them through cough and phlegm. Prolonged coughing and change of color of phlegm are signs of problem. Cardiovascular system. Cardiovascular system carries oxygen, nutrients, waste product, etc., which is circulated throughout the body through blood and lymph vessels. Heart. The human heart is divided into 4 chambers. It keeps contracting and relaxing and pushes the blood continuously like a pump. Blood vessels and the arteries and blood vessels carry blood that contain a lot of oxygen from the heart to the rest of the body. When the veins collect blood that contains a lot of carbon dioxide, the waste product from all corners of the body, and carry it back to the heart and lungs. Capillaries are the branches of blood vessels between arteries and veins. Pulmonary circulation and systemic circulation. Systemic circulation, upper body, supravena cava, pulmonary artery. We have the lungs. Pulmonary circulation, we have the pulmonary veins. Aorta, it is a branch. We have the left atrium in the heart and the left ventricle, right atrium, right ventricle. We have the inferior vena cava on the systemic circulation on the lower, inferior for the lower body, and superior vena cava for the upper body. The pulmonary circulation system, the oxygenated blood changes to oxygenated blood. Systemic circulation and pulmonary circulation. Arterial blood flows in the arteries and venous blood flows in the veins and circulate through the body, which is called systemic circulation. The circulation of the blood from the heart to the lungs and back to the heart called the pulmonary circulation. Venous blood from the right ventricle of the heart flow to the pulmonary arteries. The lungs during gas exchange. When it comes to arterial blood and returns the left atrium through the pulmonary artery. So the systemic circulation and pulmonary artery. Arterial blood flows in the arteries. Okay? And venous blood flows in the veins. Circulate through the body, which called the systemic circulation. The circulation of the blood from the heart to the lungs and back to the heart is called pulmonary circulation. So the venous blood from the right ventricle of the heart flows through the pulmonary arteries. So sa right yung pulmonary arteries. Sa left ang when it comes to the arterial blood, it returns to the left of the atrium through the pulmonary arteries. Pulmonary veins. Okay, venous blood flow from the right ventricle of the heart flows through the pulmonary arteries to the lungs during gas exchange. So sa left, from left ventricle, sa right, from right ventricle, pump going up to pulmonary arteries. Then, gas exchange. After gas exchange, it returns to left atrium. From right, going to the left atrium through pulmonary arteries. And then, pump. Then, distribute to the body, towards the body. So, galing from the right, the oxygenated blood pumps it and goes to the pulmonary artery, and then gas exchange. After gas exchange, go to the right, go to the left, from right to left. We have the pulmonary veins, and then from the pulmonary veins back to the heart and pump going to the aorta, then going back to the upper and lower body. So we have the inferior vena cava and superior vena cava. Okay, for the right. So from inferior vena cava going to the heart, and then going to the ventricle, right atrium, going to the right ventricle, pump to the right ventricle, going to the pulmonary artery, change oxygenate to oxygenated blood, and goes back to the pulmonary vein. From pulmonary vein to atrium and ventricle, pump going to aorta and going to the upper and lower body. Okay, we have digestive system. So the human digestive system consists of the gastrointestinal tract from the oral cavity to the arms to the anus, esophagus, stomach, small intestine, large intestine, and the organs that secrete digestive enzymes. So the system digests and absorbs food, take in necessary nutrients, and excrete the waste product of digestion as feces. So this is the flow of the function of the organs. Number one, so from the mouth and going to the esophagus and chew and swallow the food and pass through the esophagus through the stomach. And then from the stomach, we have the peristalsis begin. When the food is sent to the stomach, the food is digested by the stomach fluid. Then number 3, it goes to the small intestine. The food and nutrients are absorbed. Then for number 4, it goes to the large intestine from small intestine. So the large intestine, nutrients and liquid are further absorbed. And feces are formed. Then number 5, it goes to rectum. The accumulated feces stimulates the rectal walls and urge to defecate occurs. And number 5 is the anus. The anus has an anal sphincter loosens and the feces are excreted. That's the flow. Urinary system. Urinary system is responsible for removing waste from the body. So the urine is formed in the kidney and carried to the bladder through the ureter. It is temporarily stored in the bladder and then excreted out of the body through the urethra. So, from kidney, going to we have the renal pelvis, and then go to ureter, and then bladder, go to the bladder, and then through urethra, excreted in urethra. So we have the endocrine system. The endocrine system is a system of glands and secrete hormones that regulate various functions of the body. We have the pituitary gland, the pineal gland. This is the endocrine system. Parathyroid gland, the thyroid gland. We have the thymus. We have the adrenal glands on the top of the kidney, and we have the pancreas, which is the biggest endocrine system. We have the ovary for the female and the testes for the male. Then we have the immune system. Immunity refers to the reaction to resist and protect the body against invading germs, viruses, and other pathogens that exist in external environment. Lifestyle and state of mind will either enhance or lower immunity. So the lifestyle and state of mind to enhance immunity, we have activities that enhance the immunity. For example, moderate exercise, laughing a lot, keeping the body warm, and well-balanced diet. Factors that lowers immunity, we have aging, shortage of sleep, fatigue, strenuous exercise, and psychological stress. Mechanism of human body related to rest and sleep. So need for rest and sleep. To rest means to stop being active and relax your mind and body. Taking appropriate rest will help recover from fatigue and serve as source of a happy life. Sleep lets the brain take break regularly. It's essential for the health of your mind and body. It is sleep, essential for the mind and body. Positive effects of good sleep. Consolidation of memories. Increased immunity. Removal of fatigue from mind and body and relieve stress. Mechanism of sleep. Everybody has internal body clock that operates on a cycle of 24 hours, keeping a rhythm. The internal body clock is reset by the morning sunlight and start keeping regular rhythm. Cycle of sleep. A night sleep consists of the repetition of non-REM sleep, deep sleep, and the REM sleep, shallow sleep. During non-REM sleep, the brain is in the state of resting. During the REM sleep, the brain is close to state of being awake. It is said that you have dreams during REM sleep. So the REM sleep, the brain is close to the state of being awake. During the non-REM sleep, the brain is a state of resting. So the non-REM sleep, for example, the brain is sleeping. You do not have any dreams. The REM sleep, the brain is not sleeping. You have dreams. 4 characteristics of sleep on elderly people. Sleeping hours become shorter. The length of non-REM, which means the brain is sleeping and you have no dreams, or this is deep sleep, becomes shorter, which makes him or wake up frequently due to urge in urination and small noise, etc. Understanding of people in needs of nursing care. Basic understanding of aging. Understanding of physical, mental, and mental changes associated with aging. What is aging? Physical and mental function decline as we age. This is called aging. When the physical and mental function decline, it's called aging. Agings occur to everybody from childhood, school age period, adolescent period, maturity period, and old age period. Characteristics of aging. Individual difference exists. Elderly people are more vulnerable to diseases. The influence of lifestyle can be seen. Mental change due to aging. Mental changes are affected by the history, time, background, and living environment of elderly people, which causes individual differences. Again, mental changes due to aging. Mental changes are affected by history, time, background, and living environment of elderly people. So the mental changes affected, which causes individual difference. Therefore, it is necessary to understand that each person is different when you provide nursing care. Anxiety, mental changes, anxiety and frustration. Anxiety and frustration are caused by, among others, the fact that they are no longer able to do what they could do before. Sense of loss and sense of helplessness. They are caused by, among others, the separation by death of husband, wife, relative, or friend, and the change in role. The mental change makes elderly people more vulnerable to depression. Physical changes due to aging. Changes occur in the appearance and internal parts of the body due to aging. The hearing ability decreases, especially the ability to hear higher frequency and sound. Hearing ability decreases, especially the ability to hear higher frequency sounds. It's called presbycusis. Respiratory function decreases, which increases the vulnerability to infectious disease. Renal function decreases, and the frequency of urination changes. Muscle strength reduces, which increases the vulnerability to falling. Eyesight becomes poorer and failed to view narrower. Field of view is narrower. Ability to taste reduces. The ability to chew, mastication, and swallowing, deglutition, is reduced. Vascular walls become thicker and the blood pressure goes up. Intestinal peristalsis decreases, which increases the vulnerability to constipation. An elderly person suffers from a number of diseases that are chronic and tend to take longer to heal, with high possibility of complication. Symptoms frequently found in elderly people and characteristic of diseases. Symptoms frequently found in elderly people include dehydration, fever, constipation, edema or swelling, insomnia, disuse syndrome, and pressure ulcer or bed sore. Characteristic of disease of elderly people. Each person suffers from number of diseases. Individual differences are intensive with regard to symptoms. Aged people are vulnerable to diseases that tend to become chronic. Symptoms are not very visible, atypically of symptoms. Symptoms frequently found in the elderly people also is dehydration. Dehydration refers to the state where there is a lower than normal amount of fluid in the body. Constant amount of fluid is maintained in the body, but dehydration occurs when the balance between intake and excretion is lost. Causes: diarrhea, vomiting, fever, perspiration, decrease in fluid intake. Symptoms: dry lips, oral cavity, and skin, decrease urinary frequency and urine volume, lower blood pressure, higher pulse, and higher blood temperature, etc. Points of nursing care: hydrate the user, control the room temperature, have the user take the fluid before and after the bath, and while exercising. Serious dehydration may lead to death. Have the user visit a medical facility. Fluid balance: maintenance of the balance between the fluid intake and excretion of orally taking food and drinks will lead to maintenance of healthy life. Fever. When you have a fever, your body temperature is higher than normal. The hypothalamus of the cerebrum controls the body temperature. The hypothalamus of the cerebrum controls the body temperature. Causes: infectious disease, inflammation, and dehydration, etc. Symptoms: high fever, flushed face, lack of energy, lack of appetite, etc. Points of nursing care: hydrate the user, take the body temperature. Sometimes the symptoms of fever are not apparent in elderly people. Observe if there are any other symptoms. Constipation. Constipation is a state in which the feces remain in the large intestine for a long time. Usually, the food take will be excreted feces in about 24 to 72 hours. Causes: reduced function of intestines, lost muscle strength, suppression of urge to defecate, etc. Symptoms: lack of appetite, stomach ache, nausea, etc. Points of nursing care: help the user to take dietary fibers and engage in moderate exercise. Have the user to make a habit to sit on the toilet seat after each meal. Massage the abdomen with the strokes that follow the path of the large intestine. Massage with strokes that follow the path of the large intestine. So from the right going to the left down. Okay? We have edema swelling. Edema refers to build-up of excess fluid in the body due to reduced function of internal organs and loss of muscle strength. Causes: reduced strength of lower limb, reduced function of the heart and kidney, undernutrition in elderly people, prolonged maintenance of sitting position, weight gain is the symptoms, etc. Points of nursing care: observe the region and degree of edema. A person with paralysis tends to have edema or affected side on the affected side. Have the user engage in moderate exercise and provide leg elevation. If the user has disease causing edema, have him or her receive a medical treatment. Pruritus or itching. Pruritus is a state of having itchy skin. Causes: dry skin due to aging, changes in temperature and humidity, types of clothes, etc. Change in temperature and humidity, types of clothes, etc. Symptoms: flare, rash, frustration, etc. Points of nursing care: moisturize the skin of the user. Be careful not to damage the skin and see that she or he does not develop an insomnia. If there is a possibility of infection, cooperate with the medical staff. Insomnia. Insomnia is a state in which a person experiences lack of satisfaction and having slept well, difficulties in falling asleep, and mid-sleep awakening, which causes sleep insufficiency. Causes: change in sleep content, etc. Symptoms: frustration, fatigue, malaise, etc. Points of nursing care: control the cardiac rhythm, control the circadian rhythm. Have the user get sunlight when he or she wakes up. Have him or her have an engaged in moderate exercise. Have him or her to avoid taking long nap during daytime. Keep the room and environment well organized. If the user is having difficulties in daily living, cooperate with the medical staff. Hypertension. Hypertension is when blood pressure is too high. Causes: heart disease, kidney disease, change in blood vessels associated with aging, diet, exercise, and other lifestyle factors. Causes of heart disease is causes of hypertension, heart disease, kidney disease, change in blood vessels associated with aging, the diet, exercise, and other lifestyle factors. Symptoms: headache, palpitation, etc. Points of nursing care: helping improve the lifestyle, encouraging the user to be careful not to overeat, not to take too much salt, and engage in moderate exercise. The methods of treatment include diet therapy, exercise therapy, drug therapy. Prolonged hypertension will cause atherosclerosis, which in turn will cause cerebral, vascular, and heart disease. Disease frequently found in elderly people. Disease frequently found in elderly people include cerebral, vascular disease, heart disease, pneumonia, aspiration pneumonia, diabetes mellitus, osteoporosis, and dementia. There are people for whom doctors' instructions are required to provide them with nursing care. Cerebral vascular disease. Cerebrovascular disease refers to the disorder of the brain blood vessel. It is caused by clogged or broken blood vessels. Cerebrovascular disease. and may result in the various disabilities depending on the region of the brain affected. Causes. The causes are largely classified into two groups: clogged blood vessels in the brain. It's cerebral infarction. Broken blood vessel in the brain. It's cerebral hemorrhage, etc. Symptoms: headache, dizziness, nausea, vomiting, disturbance of consciousness, respiration disorder, disturbance of perception, etc. Points of nursing care. Provide nursing care based on the symptoms of the user, as it is related to lifestyle. Pay attention to the amount and contents of food and exercise. It is related to lifestyle. Pay attention. Okay? Provide nursing care based on the symptoms of the user. Cerebral infarction, clogged blood vessels. Cerebral hemorrhage, broken blood vessels. Heart disease. Heart disease is caused by clogged blood vessels and others. Causes: hypertension, diabetes mellitus, change in coronary arteries, etc. Blood vessels of the heart get narrower. Angina pectoris. Blood vessels of the heart get clogged. Myocardial infarction. Function of the heart get reduced. Heart failure. Symptoms. So you repeat. Angina pectoris, when the vessel get narrower. Myocardial infarction, when the vessel of the heart get clogged. And heart failure, when the function of the heart is reduced. Symptoms in case of angina pectoris. A momentary lack of oxygen will cause chest pain. In the case of myocardial infarction, the necrosis of the heart muscles will cause severe chest pain. In the case of heart failure, the symptoms include feeling of smothering, palpitation, shortness of breath, malaise, edema, weight gain, and decrease in urine volume. So, angina pectoris, lack of oxygen, and cause the chest pain. Myocardial infarction, necrosis of the heart muscle, will cause also chest pain, but the heart failure will have a palpitation, shortness of breath, malaise, edema, weight gain, and decrease in urine volume. So, points of nursing care. It is necessary to refrain from taking salt and fluids in case of edema and weight gain. If the user is having difficulties in breathing, have him or her stay in the bed and assume a position that will help reduce the burden on the heart. For example, like sitting position. Okay? Angina pectoris, blood vessels of the heart get narrow. Myocardial infarction, blood vessel of the heart get clogged. Position that will help to reduce the burden of the heart, like this. Sitting and forward. Your head is forward. We go to pneumonia. Pneumonia is caused by pathogens entering the lungs. Causes: infection by pathogens such as germs and viruses. Symptoms: general symptoms such as fever, malaise, lack of appetite. Symptoms: respiratory organs such as cough and phlegm. Points of nursing care. Be creative and help the user stay hydrated and cook meals that are easy to eat. It is necessary to be careful of symptoms sometimes do not show in the case of elderly people. Aspiration pneumonia. Aspiration pneumonia is caused by bacteria mistakenly entering the trachea and bronchial tube with food and saliva. Causes: food and liquid getting into the trachea, not in the esophagus. So the symptom is fever, cough, phlegm, lack of appetite, etc. Points of nursing care for aspiration pneumonia. Pay attention to the posture. The users assume that the time of eating. Do not have him or her lie down after meal. Instead, have him or her maintain sitting position. Take care of the oral cavity of the user. If symptoms are visible, cooperate with the medical staff. So this is the pathophysiology. Accidentally swallow the food and drink. The bacteria enter to the lung with food and drink. And then inflammation occurs. Aspiration. Next is diabetes mellitus. Diabetes mellitus is a disease of metabolic disorder causing a high blood sugar. Causes. There are two types of diabetes mellitus. One is type 1, next is type 2. Type 1 diabetes mellitus, insulin secretion is lacking. The patient are often young. Type 2 diabetes mellitus, the insulin secretion is reduced. The patient are often aged. It is regarded as lifestyle disease caused by overeating, lack of exercise, stress, etc. Symptoms: dry mouth, excessive drinking, urination, weight loss, malaise, fatigue. Points of nursing care. The methods of symptoms of diabetes: dry mouth, excessive drinking, and urination, weight loss, malaise or fatigue. Oh my God. Points of nursing care. The methods of treatment include diet therapy, exercise therapy, and drug therapy. Keep the calorie intake low. Diet therapy. Be creative so as to not lower meal satisfaction. Continuous hyperglycemia will make any wound slow heal. Complications include retinopathy, kidney disorder, and neurotic disorder. It is necessary to prevent complication in cooperation with the medical staff. Prevent complication in cooperation with medical staff. So, complication of diabetes mellitus, number 1, neurotic disorder. So, nagkakaroon ng panginginig. So, kidney disorder and retinopathy affecting the eyes. So, osteoporosis. Osteoporosis is the disease in which the risk of a broken bone increase due to low bone mass. So, the causes is being bedridden for a long time, calcium deficiency, etc. The women become more vulnerable when the female hormone level goes down. Symptoms: have a stoop back, grow shorter, have a lower back pain, etc. The affected person is vulnerable to bone fracture when he or she falls because of the bones have become fragile. Points of nursing care. Have the user eat calcium-rich food. Have him or her engage in exercise and bask in the sun. Have him or her improve the living environment to prevent falling. Regions of the bones fracture often found in elderly people. Number 1, the humerus, braso. The spine. Okay. Next is the radius and the femoral neck. Dito sa may hips. Basic understanding of disorder, disability, and impairment. What is disorder, disability, and impairment? The United National Convention of the Rights of Persons with Disabilities or UNCRPD states persons with disabilities include those who have long-term physical, mental, intellectual, and sensory impairments, which in interaction with various barriers may hinder their full and effective participation in the society on an equal basis with others. The Internal Classification of Function and Disability and Health, or ICF, regards disability as people health characteristic instead of focusing the negative factors. So what is ICF? International Classification of Functioning. So this is disability and health. Health condition, disease, disorder, etc. Under this diagram, we have the function, body function, and structures, activities, and participation. So the body function and structures is physical paralysis, muscle weakness, finger loss, etc. For the activities, we have ADL and IADL. Participation, role in the workplace, role in the local community. We have environmental factors, living environment, family, local resources. And personal factor is gender, age, personality, and values. Okay. Number 2, types of disabilities, causes, and characteristics. We have a physical disability. Physical disability is a state in which the person has damaged the limb, the trunk due to disease, accident, and is having difficulties in daily living and social life. It is caused by, among others, damage to hand, feet, brain, spinal nerves due to disease, accident, and deformation, contracture of joints, spine due to disease, and their after effect. The degree of difficulty of daily activities differ from person to person depending on the region and the degree and disability. Sometimes intellectual disability occurs concurrently with motor dysfunction. Use a cane, while wheelchair, artificial leg, and assistive device suitable for the user. Explanation of terminology. International Classification of Functioning. ICF, International Classification of Functioning, Disability, and Health. ICF is classification of human functioning and disability for understanding of overall condition of the person. Human function indicates the ability function, the environment needed in the daily living, such as body function and structure, activities, and participation. Visual impairment. Visual impairment is a state in which a person is having difficulties in daily and social life due to disability related to how she or he sees things as eyesight and field of view. The causes include congenital factors, those who are born with the disorder. So we have disease, accident, and aging. The number of cases of visual impairment caused by diabetes mellitus has been increasing. The degree of visual impairment differs from person to person, including those who are totally blind and those who are able to sense light, and those who are suffering from a narrow visual field. Symptoms of visual impairment: scotoma centrale, visual field defect. So more on the center, there's a spot, dark spot. We have narrowing of visual field, more on outer around the circle area. And we have the hemispatial neglect. About half of the vision is dark. So the symptoms of visual impairment are scotoma centrale. in the center, narrow of visual field on the circle, and hemispatial neglect on half of the view has dark spots. Okay, so hearing disorder. Hearing disorder is a state in which the person is unable to hear or has difficulties in hearing because of the route of transmission from the ears to the auditory center is damaged. Hearing disorder can classify based on the level of hearing, region of impairment, and time of onset. Hypacusia. Hypacusia is a partial inability to hear. The means of communication include the use of hearing aid, conversation by means of writing, use of sign language, and conversation of speech, lip reading. Conversation by means of writing, sign language, speech, lip reading, and hearing aid. Language disorder. Language disorder is a state in which the person has difficulty in communication using speech due to damage to the language center of the cerebrum and speech organs. It is a state in which the person finds it difficult to hear, speak, and write due to acquired damage to the language center of cerebrum. The means of communication including conversation by means of writing and use picture cards differ depending on the state of disorder. So, user with aphasia, for example, banana, the person wants to say something but cannot complete say the word. It's aphasia. Malfunction of the heart, and the heart is unable to pump the blood to the entire body. Some of the users may have the pacemaker implanted in their chest due to the problem with pulse. Points of nursing care. Ensure that the user avoid exercising when there is a possibility of having blow to the chest where the pacemaker is implanted. Artificial pacemaker. Malfunction of kidney. So points to remember of nursing care is to avoid exercising when there is a possibility of heavy blow to the chest where the pacemaker is implanted. So should not exercise with the person. Avoid exercising with pacemaker. Malfunction of the kidney. The kidney is unable to filter a clean blood. The user undergoes artificial dialysis to clean the blood when his or her kidney is malfunctioned. So, mechanism of artificial dialysis. Points of nursing care. The user should avoid taking bath on the day she or he undergoes dialysis. The user should not carry anything heavy using her arm due to dialysis shunt is placed. And the user should take only limited amount of salt and liquids. Malfunction of respiratory organs. It is a state of having difficulties in breathing. The user who is unable to breathe sufficiently is treated with oxygen therapy. So we have a portable oxygen inhaler and oxygen concentrator. So, points of nursing care. Avoid open flames when using oxygen concentrator. This is important. It is important to prevent infectious disease. Have spare batteries, etc. Read as precaution against the power failure. So, it's important for the nursing care about when introducing oxygen therapy. So, avoid open flames. Malfunction of bladder rectum. It is a state of inability to excrete urine, feces due to bladder and rectum disease. An opening stoma is surgically made into the abdomen to divert the flow of the waste of our body. Artificial urinary bladder and artificial anuses are available. The placement differs depending on the disease. So, for example, we have the artificial urinary bladder and artificial anus. External appearance of the equipment. Points of nursing care. A care worker disposes of the waste in the pouch bag over the opening of the stomach. The care worker disposes of waste in the pouch bag over opening the stomach. If there is rash around the stomach, report it in the medical staff. Intellectual disability. The person with intellectual disability is low intellectual development in general. If he or she is having difficulties in daily, she or he needs some special assistance. Points of nursing care. Life stage. Specific response should be provided. Identify the state of the user and provide care suited to him or her. Mental disability. Mental disability is a state in which a person is suffering from mental function disorder due to mental disease and has difficulties in performing daily activities and participating in the society. If the condition becomes serious, he or she may significantly lose her judgment ability and control of behavior. Mental disabilities include schizophrenia and mood disorders. Some of the symptoms of the person with a mental disability and auditory hallucination are some of the symptoms of person with mental disability are auditory hallucination, delusions, and depressions. Symptoms of mental disability is delusion, depressive state, and manic state. Delusion, auditory hallucination, and delusion occurs. Depressive state, a state of getting dispirited, speaking little, and being highly depressed. Manic state, a state of being abnormal, exhilarated, and open-minded. Manic stage, a state of being abnormal, exhilarated, and open-minded. Basic understanding of dementia. Understanding of dementia. The brain controls the activities of human. Dementia refers to the disease in which the cognitive function of the brain decline due to some causes, resulting in difficulties in daily and social life. Functions of the brain. So it is necessary to learn the function of the brain for the understanding of dementia. The decline in function of the brain will cause trouble in life. The four major lobes of the cerebrum and their functions. One is frontal, two parietal and temporal, and occipital. So for the frontal lobe, and we have the sense of smell, integration of movements, feelings, motivation, will, etc. For the parietal lobe, we have a sense of taste, judgment, understanding, etc. Sense of taste, judgment, and even the sense of touch when you get burned. Okay, sa frontal lobe is thinking. Temporal lobe, auditory sense, understanding of language and knowledge of memory. Occipital is the eyesight, etc. Definition of dementia. What is cognitive function? Memory, language, action, perception, develop, plan, arrange. Okay, definition of dementia. What is cognitive function? So in memory, we can memorize and remember the language we speak and understand. So action, the activities of daily living. Perception, recognize things. And develop, plan, and arrange things. That is cognitive function. So difference between forgetfulness and dementia. Forgetfulness is among the main symptoms of dementia. Forgetfulness comes with age, but it is different from forgetfulness of people with dementia. So there are different types of forgetfulness. We have forgetfulness associated with aging. Forgetting part of the experience. Forgetting part of the experience. Forgetting. This is a forgetfulness associated with aging. Forgetting part of the experience. Forgetfulness does not progress. Aware of forgetfulness. Forgetfulness causes no difficulties in life. Forgetfulness associated with dementia. Forgetting the whole experience. Forgetfulness, progress. Do not aware of forgetfulness. Forgetfulness causes difficulties in life. But in case of forgetfulness associated with aging, she is aware of the forgetfulness, and forgetfulness does not progress. So we have points of people with dementia. When taking care of the person with dementia, think from the standpoint of the user. It is necessary to provide nursing care that is centered on the user. Understand the life of the user. It is necessary to provide support for stable life. Provide support after identifying that the user can do what the user can do. And next, provide support and bring out the ability and motivation of the user. Main causative disease, symptoms, etc. of dementia. The causative disease of dementia include dementia of Alzheimer's type, vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. So main causative disease and symptoms, etc. of dementia. We have a classification. Number 1 classification is dementia of Alzheimer's type. The condition is the brain shrink. Senile plaque appear, and the main symptom is onset is slow and progress gradually. Starts with memory impairment, often in good mood. Medication too slow to progress of the disease is available. Number 2, we had the vascular dementia. So, the vascular dementia, blood vessels get clogged. While the Alzheimer's, the brain shrink. senile plaques appear. So, for the vascular dementia, the vessels got clogged due to cerebrovascular disease and part of the brain cells die. So, progress in the state of hemiplegia, language disorder. This is the symptoms. And there are things that the patient can do and cannot do. Dementia with Lewy bodies. Dementia with Lewy bodies condition of the brain. The Lewy bodies appear and the occipital lobes shrink. And the main symptoms, etc., is see things that do not exist, hallucination, brachyphagia, etc., Parkinson's disease-like symptoms, scream while dreaming, behavior disorder. We have the frontal temporal dementia. The frontal temporal dementia condition of the brain, the lobes shrink on part of the frontal and parietal. So lack of judgment, this is the symptoms. Loss of inhibition, change in personality, patterned activities, excitement, and aggressive. Symptoms of dementia. Symptoms of dementia can be classified as follows. Core symptoms caused by the brain damage. Memory impairment, cognitive impairment, executive function disorder, comprehension disorder, judgment and impairment, etc. Behavioral and psychological symptoms of dementia or BPSD. These symptoms are caused by the environment, personality, and nature of the user, human relation, etc. Anxiety, frustration, hallucination, delusion, excitement, aggressive behavior, and wandering. These are the symptoms of dementia. So, core symptoms of behavioral and psychological symptoms of dementia. We have the brain cells die. If the brain cells die, the core symptoms, the memory impaired, cognitive impairment, excessive function disorder, comprehension disorder, so judgment and impairment, and others. We have the personality, nature, and environment, mental state. Behavioral and psychological symptoms of dementia. We have anxiety, frustration, hallucination, delusion, excitement, aggressive behavior, and wandering. The BPSD are sometimes referred to as peripheral symptoms. So the core symptoms, memory impairment. Memory impairment refers to a disorder that makes it possible to remember new facts and information. This is one of the core symptoms of dementia. It's impossible to remember new facts. Number 2, we have cognitive impairment. Cognitive impairment refers to the disorder that makes it possible to recognize the place and people. It's impossible to recognize the place and people. Cognitive. In memory impairment, it's impossible to remember new facts and information. In cognitive impairment, it's impossible to recognize time, place, and people. The person wakes up in the middle of the night and tries to go out. In cognitive impairment, the person cannot recognize the family members, sees them as strangers. Number 3, executive function disorder. The person with executive function disorder cannot remember procedures, becomes unable to carry out various activities because become unable to execute procedures, for example, cooking. This is executive function disorder. Forgot to do some procedures. And number 4, we have comprehension disorder or judgment impairment. Becomes unable to make judgments due to decrease in comprehension, judgment ability, counting money, for example. becomes difficult task. Comprehension Disorder. We have behavioral psychological symptoms of dementia or BPSD. Behavioral symptom: excitement, aggressive behavior. Excitement and aggressive behavior are caused by the person anxious, feeling as he or she does not understand what other people do to him or her, inability to let others know of him, her pain or urge to defecate, urge to urine. So excitement, aggressive. It is considered that his or her aggressive behavior is caused by inability to let her know his pain, urge to defecate, and urge to urinate. This is excitement, aggressive behavior. Behavioral symptoms. We have wandering. Wandering is the behavior of roaming around of some purpose and or because of some reason that makes the person unable to stay still. Roaming around, unable to stay still. Next is psychological symptoms. A person with dementia has anxiety and confusion. This is psychological symptoms. A person with dementia has anxiety and confusion. We have hallucination. Hallucination refers to the state in which a person feels something that does not actually exist. Okay, so may nakikita siya na hindi naman nakikita ng iba. And we have a delusion. Delusion refers to the state in which a person believes something that is not real. So, for example, you see user, pinagbintangan niya si care worker na ninakaw, na may nilagay siyang pitaka doon sa box, which is wala naman talaga siyang nilagay, nahanap niya. Or pinagbibintangan niya yung user na kinuha yung pitaka niya. So, points to remember regarding nursing care for a person with dementia: do not deny his or her words and behavior. Just accept them. Listen to him or her carefully to give her a feeling of security. Talk to him or her with a simple, easy understanding words according to his or her ability to understand. Organize his or her rhythm of daily life from morning to bedtime. Think and act together to get his or her anxiety, to get rid of his or her anxiety. Do not easily change the room and environment surrounding open. So that's it. Thanks!